I would love to share a personal experience here about my case with threatened miscarriage. When I was pregnant with my fourth child, I woke up one morning with a lot of cramping pain in my abdomen. And when I went to use the bathroom, I noticed that I was spotting. So I decided to go to the emergency room, which is what I advise all women who notice any kind of bleeding during pregnancy to do, is to go to the emergency room or go to a doctor and get examined. When I arrived, an ultrasound was conducted, and the doctor who saw me simply said that there's nothing really that can be done because my pregnancy was so young. Remember, it's only 7 weeks, and I was sent home told to avoid any sort of pelvic activity and that I should allow my body to rest, and we'll just see what comes of it. That bleeding persisted for about 3 days. At 11 weeks pregnant, it occurred again. I went back to the emergency room and was told the same thing. And it continued periodically during my pregnancy. But I carried my baby till she was almost 39 weeks in the womb and delivered her safely with no complication. So rest assured that threatened miscarriages do not always lead to inevitable miscarriages. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. Make sure you look around at some of the other videos and topics that I have already covered, as I believe that they may be of value to you. Also, make sure you hit the subscribe button and don't forget to turn on your notification bell, because that is how you are made aware of every time a new video is uploaded on the channel. Now, as you can tell by today's title, I'm going to be discussing some reasons why a woman may experience bleeding during her pregnancy. Keep in mind though, and a lot more information will be provided in the body of this video, that just because a woman is bleeding, it does not mean that she is experiencing an adverse outcome. Make sure though that you do not use the content of this video to diagnose yourself or to treat yourself. Work with a doctor or a healthcare provider that knows your health history and your concerns so that they can make a plan of care that addresses those needs. Now, pregnancy is a very exciting time in a woman's life. It is full of growth and the promise of new life, but it can also come with a lot of worry, and those worries have good grounding. For instance, it may be a woman's first pregnancy, and because she has never dealt with such things before, she worries a lot about the things that she's experiencing. Or mothers who have been pregnant before and had difficult pregnancies or dealt with some adverse outcomes may also experience a lot of concerns that they want addressed during this current pregnancy. So I hope that you learned something new from the information that is presented here. I also want to make a request of every mom who has had at least one pregnancy or is the mother of multiple children. If you can, make sure you comment in the section to let other mothers know that there are chances that they may experience some of these things and that they may continue to have a healthy pregnancy, that a lot of these things do not always end up in bad outcomes. The more we support ourselves in this community, the more learning is enhanced and the more confident a lot of especially new mothers can feel. Now, without further ado, we're going to jump right into today's video with the first reason why a woman may experience bleeding during her pregnancy. Reason number one for pregnancy-related bleeding is known as implantation bleeding. Now, implantation bleeding is bleeding that occurs as a fertilized egg begins to nestle itself into a woman's uterus. If you didn't know, the uterus is a highly vascular muscle, meaning that it has a lot of blood vessels. And as your fertilized egg begins to burrow itself into the uterus, it may cause a lot of those little blood vessels to burst as it gives way to allow your forming baby to embed itself in your uterus, and a woman would then see bleeding from that embedding and may suspect that she is bleeding or experiencing a loss. Keep in mind that conception and pregnancy are two different concepts. A woman conceives when sperm meets egg and join together to form this zygote that will begin to divide into an embryo and a fetus and become a baby that a mom will deliver at full term. That product of conception, or that newly fertilized egg, does not begin pregnancy until it has embedded itself in the uterus. That process can start anywhere from a week after a woman ovulates to up to 2 weeks after she has newly conceived. Now, keep in mind that implantation bleeding is usually not as heavy as a woman's expected menstrual period. It's usually lighter and will last about 2 or 3 days. So if you experience bleeding that kind of meets this requirement, you may need to rest easy, as you may be experiencing implantation bleeding. The next reason why a woman may bleed during pregnancy is known as a threatened miscarriage. Keep in mind that a threatened miscarriage is not the same thing as an inevitable miscarriage. During a threatened miscarriage, a woman may experience signs and symptoms such as abdominal pain and light to moderate or even sometimes heavy vaginal bleeding. But this bleeding, even though it can continue for a long time, sometimes for weeks, it does not affect the development or growth of the baby or the continuation of the pregnancy. I would love to share a personal experience here about my case with threatened miscarriage. When I was pregnant with my fourth child, I woke up one morning with a lot of cramping pain in my abdomen. And when I went to use the bathroom, I noticed that I was spotting. So I decided to go to the emergency room, which is what I advise all women who notice any kind of bleeding during pregnancy to do, is to go to the emergency room or go to a doctor and get examined. When I arrived, an ultrasound was conducted, and the doctor who saw me simply said that there's nothing really that can be done because my pregnancy was so young. Remember, it's only 7 weeks, and I was sent home told to avoid any sort of pelvic activity and that I should allow my body to rest, and we'll just see what comes of it. That bleeding persisted for about 3 days. At 11 weeks pregnant, it occurred again. I went back to the emergency room and was told the same thing. And it continued periodically during my pregnancy. But I carried my baby till she was almost 39 weeks in the womb and delivered her safely with no complication. So rest assured that threatened miscarriages do not always lead to inevitable miscarriages. Now, there are some risk factors that can increase the likelihood of dealing with a threatened miscarriage. So if you deal with any of these, make sure you address the factors that you can address and then talk to your healthcare provider to see if there are things that can be done to help limit or lower the chances that you will experience this. And some of those risk factors include smoking or drinking during pregnancy, taking in too much caffeine, some medications, any type of abdominal trauma, infection, and then women who are pregnant with multiples or deal with high blood pressure can also increase the likelihood of dealing with a threatened miscarriage. Some of the things your doctor may advise you to do to decrease the chances of exacerbating or making worse a threatened miscarriage is to rest in the bed to avoid any added stress. Certainly no pelvic or cervical activity such as sexual intercourse, and don't douche. A lot of women douche, and I don't know why. When you are pregnant, douching is very much so contraindicated. Reason number 3 why many women deal with bleeding during pregnancy, and I saw this a lot during my bedside practice, is sexual activity. A lot of women during their pregnancy have no limitations on how many times they can be intimate with their partners. But for some others, you got to kind of watch how frequently and what kind of positions and things that you are doing when you engage with your partner in sexual activity. The reason being, when a woman becomes pregnant, her cervix becomes engorged in blood. You have higher blood volume and increased blood flow. So any type of irritation to the cervical region, such as sexual intercourse, or even when a woman gets like a transvaginal ultrasound, that can irritate those sensitive tissue, and that can cause abdominal cramping, just a little bit of cramping and a little spotting or bleeding. If you experience these things, a lot of them may resolve on their own, but if it persists and lasts for, let's say, a day or two, and it's bright red blood or it just will not stop, make sure you go get examined by your doctor, because you do not want something to be on board that can be controlled much earlier. Reason number 4 why a woman may bleed during pregnancy is because of infection. When women become pregnant, Mother Nature just naturally weakens a mother's immune system so that her body does not reject her pregnancy. However, with your immune system being weakened, you are naturally at a higher risk for infection. Many women deal with infections such as bacterial vaginosis or yeast infection. And then because of a higher risk of infection, you can come in contact with sexually transmitted diseases such as chlamydia, gonorrhea, herpes, among a slew of other diseases that plague not just pregnant women, but all women and all people. Keep in mind that infection and your body do not like one another. When bacteria or fungus or viruses enter a woman's body, they come and they damage delicate blood vessels or can even be very destructive to sensitive tissue. And that increased irritation will cause those blood vessels to break or compromise the integrity or firmness of a tissue, leading to bleeding. Women, if you experience any type of bleeding or spotting or itchiness or burning in your private parts while you are pregnant, make sure you go see your healthcare provider so that those infections can be treated as soon as possible. Keep in mind that infection that is not treated as quickly as a woman can get it treated can lead to low birth weight in her baby. It can also lead to a preterm birth, or it can lead to spontaneous abortion or miscarriage. So keep those things in mind. Now, last but certainly not least, one of the reasons why a woman may experience bleeding while she is pregnant is known as placenta previa. Placenta previa is simply when the placenta is low-lying in the uterus, covering either partially or entirely the opening of the woman's cervix. Now, in the early parts of the pregnancy, the placenta is fine wherever it is because the cervix is closed. And then as a woman's pregnancy advances along, that placenta can move out of the way and not cause any more issues during the pregnancy. Unfortunately, as a woman's pregnancy begins to advance along, the baby begins to grow and, more pressure is put on sensitive tissues and on the cervix. And then as a woman approaches her due date, her cervix may begin to thin and dilate. If the placenta is right there, as the cervix is pulling thin and dilating, the placenta is also being stretched, increasing the risk of a mom experiencing bleeding. If the placenta completely closes the cervical opening, there is a chance that your doctor will tell you that you need to deliver by cesarean section. If it's a partial covering, then your doctor may need to work with you to decide whether you want to go the vaginal route or to schedule a cesarean section, as that may be safe for your baby. Remember that the placenta is how your baby gets rid of waste products and receives nutrients from you. So you do not want to compromise the integrity of that organ. The bleeding will be painless for mom, but if too much blood is lost, then it can compromise how much oxygen your baby gets. So make sure you get that bleeding checked out right away or as soon as you possibly can. Now, some risk factors for dealing with the placenta previa include having a previous surgery on your uterus, having fibroids. I dealt with fibroids. They're not a big deal until they become a big deal. So if you know you have fibroids, kind of keep abreast of them. And if you notice any bleeding that is not painful for you, make sure you go get that checked out as soon as possible. Also, women who are pregnant with more than one baby may deal with a higher risk for placenta previa just because they have multiple placentas and those placentas are doing things in their bodies that, it's not typical or it's not frequently seen in a singleton pregnancy. Now, if you have learned something in the content of this video, do not fail to give it a huge thumbs up and then make sure you hit the subscribe button. What are you waiting for? Once you hit the subscribe button, turn on your notification bell so that you are made aware of every time a new video is uploaded. And then if you know somebody who can benefit from this information, don't fail to share it with them. Join me as we create this growing community of empowered women and men across the world who are active participants in their own maternity journey. I wish you a healthy, happy, and safe pregnancy. And until the next time, be blessed.